Hi, Matthew Holt with a quick follow-up interview. This is Anthony Mormon, and it's a follow-up interview to the Robert Johnson Foundation Emergency Preparedness Challenge. This is Anthony Mormon. He is a Marketing Solutions Director at Qventus, which is the company, and he was the demoer that won the health system side of the challenge. So Anthony, congrats on your win, and thanks for joining me today.
Thank you for having me. It's been a real honor.
No worries, and as I said, definitely win the award for best facial hair of the challenge, let alone the solution. All right, so real quick, for those people who haven't seen it, and there'll be a demo associated with this, but what was the entry that Qventus made? Because they're into a lot of stuff. What was the entry that you made specifically to this challenge?
Yeah, so we developed a modified pandemic model, SEIR pandemic model, to help hospitals predict the demands on their specific resources. So as COVID was spreading throughout the United States, the model pulled in as much publicly available data as we could to help give a localized prediction of the demand on ICUs, med-surg beds, and ventilators for individual hospitals across the country.
All right, and give me a sense of how you guys, obviously you were already in that market, you already had customers who were using your product, and so I'm sure it wasn't just, oh, you saw this challenge one day and thought it might be a good idea, but give me a sense of how the inspiration for the overall submission came up and how you felt that the challenge would benefit what you were doing.
Sure. Yeah, as you said, we already worked with health systems. They're our primary customer for our core solution that we've had up and running for a while, but the pandemic hit and we saw these nationally projected models of COVID demand, or even at the state level sometimes, but nothing really that could help our customers. And so we took a look at the publicly available data and thought that we could do a better job of helping our customers and the health systems that we didn't work with yet, just everybody plan for the demand and prepare. So it was the challenge kind of inspired us to pull together our competencies. So we're good at using ML to predict things. We're good at understanding analytics and data, and kind of manipulating that and combining all that in a freely available web tool to help hospitals across the country plan for the upcoming surges.
Was there something specific that benefited your team and the application development from being in the challenge?
I think the feedback and kind of the experience of explaining and kind of describing our tool and refining it throughout the course of the challenge was really beneficial. We got to interact a lot with the judges, and just the exposure to the challenge environment I thought was really beneficial for the team from an experience standpoint, and also the feedback.
That's great. And let's talk about what you think the impact of what you built and what you're running is going to be. And it's probably already showing an impact. I'm thinking, given the surge, the mass and nationwide surge we're seeing right now. What do you think the impact is, and what's your hopes of the future of this particular application?
Yeah, the impact actually exceeded what we expected initially. I mean, it started as a small kind of Tableau visualization built from the CDC flu surge model, and it evolved into this kind of massive, highly modified SEIR model that has been used by over 1,100 organizations across the country, including different federal task forces, health departments, consulting firms, people that aren't even our core target audience for this. So they're working and trying to help facilitate hospitals to plan, figure out what their surge plans need to be. We've worked with groups of hospitals to help them collaborate and figure out how they can offload patients from one place to another to manage the surges locally. So I think the localization impact has been really beneficial to health systems, and just understanding specifically for individual markets, what's the impact and how can they work to manage that and help as many people as possible. And I think going forward, that more and more data is becoming available. As the vaccine rolls out, it'd be great if we could find ways to incorporate additional functionality to help support that. And assuming COVID becomes a seasonal thing, or there's other seasonal diseases in the future, we can use this kind of predictive surge modeling capacity to help hospitals respond in real time to these things and be better prepared.
Yeah, I mean, hopefully, it'd be nice if there wasn't a next time, but it's likely there will be a next time, and this is already done. That's fantastic.
Yeah, even the seasonal flu I think it could be helpful, this type of technology.
And so last question, sort of now, I mean, this is probably a little different for you than it would be for us, like the student team that won. But what's your plan for continued growth, and how are you going to use the prize money? I know you guys have raised a ton of venture capital already, so the prize money may not matter to you that much. But what's your plan for sort of growing this area? And
I think every bit helps, and we're an efficient small team with a lot of demands across the board. So that'll help us recruit and grow, and I think make additional investments. There's new data out there, being able to tap into kind of what the current census is, so people don't have to enter that information. Removing some of the manual inputs as much as we can would be great adds. And as the disease evolves, or if there's implications for vaccine, like I said earlier, if we could find a way to help hospitals deploy their vaccines more efficiently, or manage different types of populations in conjunction with the ongoing pandemic, I think that would be great to add, and the prize money will certainly help us prioritize that.
Fantastic. Well, I mean, talking with Anthony Moore, he's the Director of Marketing Solutions at Qventus, which won the health systems side of the Robert Wood Johnson Foundation's Emergency Preparedness Challenge that we just ran. You can see Anthony's demo of the solution, which is very cool, in a separate video, which we posted around this video. Anthony, thanks for your time.
Thank you.